Dear friends, today we will learn about hypothermia in preterm infants. In this webinar, we shall discuss about the effect of hypothermia on mortality and morbidity rates in preterm infants. We shall also learn about thermal well-being in preterm infants. Hypothermia can have many adverse effects as shown in this slide. The effects include respiratory problems like apnea, aggravation of hypoxia and persistent pulmonary hypertension. Additionally, myocardial dysfunction, shock, metabolic effects like hypoglycemia and acidosis, increase in risk of sepsis, coagulopathy and also neurological injuries. In a study by Laptok et al. In 2007 on the relationship between admission temperature and its effect on mortality and morbidity in very low birth weight infants has shown that for each 1 degree centigrade drop in temperature from normal zone increases the mortality by 28% and morbidities like infection by 11%. In this graph, x axis represents the admission temperature, y axis represents the incidence of combined adverse outcomes. This graph depicts that neonates with admission temperature lying between 36.5 to 37 degrees centigrade have a lower incidence of mortality and morbidities like severe retinopathy of prematurity, severe brain injury, nosocomial infections, necrotizing enterocolitis, bronchopulmonary dysplasia and requirement of ventilation. The mortality and morbidity rises exponentially in neonates with admission temperature below 36 degrees Celsius. In a report published by UNICEF in 2007, interventions preventing hypothermia can lead to 18 to 42% reduction in mortality and morbidity. The impact of these interventions looks promising as suggested by the numbers. Now, we will look at why a preterm newborn is more prone for hypothermia. To understand, we will look at some basic concepts in thermal regulation. First, we shall learn about the concept of thermoneutral zone. In this graph, x axis represents environmental temperature and y axis represents the basal metabolic rate of the neonate to maintain a normal temperature. You can see here the basal metabolic rate is minimal in the temperature zone between 26 to 28 degrees Celsius to maintain normal temperature in the baby. This is called thermoneutral zone for that neonate. The zone of temperature depends on the birth weight, postnatal age, the clothing and the degree of sickness in that neonate. There are 4 mechanisms by which neonate can have heat loss. They are convection, conduction, radiation and evaporation. First one is by convection, which involves the heat loss from the body surface due to air currents or air flow. Hence, it becomes important mechanism of heat loss in a very cold room with more air currents. The body can lose the heat by this method when kept in near an open window, in unregulated use of fans and air conditioners, and when cold medical gases are used for respiratory support. Second mechanism is heat loss by conduction, which occurs from the neonate's body to the cooler objects which are in direct contact with the body. Common situations include wet linen for covering or cleaning the baby and keeping the baby directly on the surfaces like weighing scale or X-ray cassette. Third mechanism of heat loss is radiation, in which the neonate loses heat to colder surrounding objects which are not in direct contact with the body. Nursing a neonate near a cold wall, inadequate clothing and keeping too many cold objects in the room shall predispose this neonate for heat loss by this mechanism. The fourth and the last mechanism of heat loss is by evaporation, and it occurs when water evaporates and gets converted to its gaseous form. So, if you do not dry the neonate fast, then this becomes major source of heat loss. Also, prolonged contact with wet linen, bathing and wet nappies or diapers are the common situations in which these neonates are prone for heat loss by this method. After understanding the mechanism of heat loss, we shall now learn about the risk factors and the physiological handicaps in preterm neonates which make them prone for hypothermia. The lesser brown fat tissue, larger surface area per unit kg of body weight, immaturity of the skin and increased insensible water loss are the main reasons for predisposition to hypothermia in these neonates. Let us now understand each of these risk factors in detail. In neonates, brown fat is located on the back, along the upper half of the spine, toward the shoulders and axilla, and also around kidneys. The brown fat, which is the major contributor to non-shivering thermogenesis, is very less in preterm neonates. It is even lesser in more immature neonates. The body surface area of a neonate per unit kg weight is 7 times more when compared to that of an adult. These neonates have limited capacity to keep the limbs in flexion, which further predisposes them to greater heat loss. So, during the neonatal period, the outermost protective layer of the skin is very thin and non-conified compared to that of an adult. The skin is also less hydrated due to immaturity of its sweat and sebaceous glands. Hence, the neonate loses heat and have higher insensible loss of water due to these evaporative mechanisms, thus leading to hypothermia. The skin usually matures to that of an adult by 2 to 4 weeks of life. The neonate skin is more prone to injuries due to adhesives and invasive lines. These injuries again increases the evaporative losses. So, the key messages from this webinar include hypothermia increases mortality and major morbidities in preterm infants. Ideal environmental temperature for nursing these neonates is based on baby's weight, postnatal age, clothing and degree of sickness. Immature and thin layers of skin, increased insensible water loss, larger body surface area and lesser brown fat tissue are the main risk factors for having hypothermia in these neonates. Thank you very much.